Medical Assistant Exam Questions and Answers. Question 1. During a skills check, the scenario states that the medical assistant needs to measure respirations after taking a pulse. Which technique is most appropriate? Option A. Count only one breath and multiply by 60. Option B. Ask the patient to hold their breath between counts. Option C. Tell the patient to breathe faster while counting. Option D. Continue holding the wrist and count respirations without alerting the patient. The correct answer is option D. Continue holding the wrist and count respirations without alerting the patient. Respirations are often counted discreetly because patients may change their breathing pattern when they know it is being observed. Coaching the breathing, counting one breath, or interrupting the breathing pattern produces inaccurate results. Question 2. After confirming the patient's identity, a pulse oximeter is not giving a steady reading on a patient with cold fingers while following standard precautions. Which action should the medical assistant try first? Option A. Apply the sensor over dark nail polish without adjustment. Option B. Ignore the reading because pulse oximetry is optional. Option C. Place the probe on a moving hand during conversation. Option D. Warm the finger and ensure the sensor is positioned correctly. The correct answer is option D. Warm the finger and ensure the sensor is positioned correctly. Cold extremities and poor sensor placement can interfere with pulse oximeter detection. Nail polish, movement, and ignoring an unstable reading can all lead to inaccurate oxygen saturation documentation. Question 3. While following clinic policy, the medical assistant notes that an infant arrives for a well-child visit for an older adult. Which measurement is commonly documented in addition to weight and length? Option A. Snellen distance score. Option B. Head circumference. Option C. Peak flow only. Option D. Waist to hip ratio. The correct answer is option B. Head circumference. Head circumference is an important growth measurement for infants and helps monitor development over time. Waist ratios, peak flow values, and Snellen scores are not routine substitutes for infant growth tracking. Question 4. For a patient scheduled for a procedure in an outpatient setting, orthostatic hypotension is suspected after a patient reports dizziness when standing. Which approach is appropriate? Option A. Measure blood pressure and pulse after position changes according to protocol. Option B. Ask the patient to jog briefly before measuring. Option C. Measure temperature in 3 routes. Option D. Take only a single seated blood pressure. The correct answer is option A. Measure blood pressure and pulse after position changes according to protocol. Orthostatic assessment compares blood pressure and pulse across position changes to evaluate a possible drop with standing. A single seated reading, exertion before measurement, or unrelated temperature checks does not assess the suspected problem. Question 5. When preparing safe patient care, a patient has questions about risks before a minor procedure while following standard precautions. Who should answer clinical risk questions for informed consent? Option A. The medical assistant by guessing. Option B. The provider performing or ordering the procedure. Option C. The receptionist only. Option D. A random patient in the lobby. The correct answer is option B. The provider performing or ordering the procedure. The provider is responsible for explaining risks, benefits, and alternatives so the patient can give informed consent. Reception staff, other patients, or guest explanations do not meet informed consent standards. Question 6. During a certification-style scenario, a patient with diabetes is involved when a medical assistant needs more detail about a patient's abdominal discomfort for a patient with diabetes. Which question uses an open-ended interviewing technique? Option A. Is the pain exactly a 5? Option B. You do not have nausea, correct? Option C. Does it hurt, yes or no? Option D. Can you describe what the discomfort feels like? The correct answer is option D. Can you describe what the discomfort feels like? Open-ended questions invite the patient to describe symptoms in their own words and often reveal more complete information. Yes or no prompts, forced ratings, and leading questions limit the response and may miss important details. Question 7. In a busy family practice clinic, a patient's height is being measured with a stadiometer. Which action supports accuracy? Option A. Measure while the patient is seated in a soft chair. Option B. Round every height to the nearest 6 inches. Option C. Ask the patient to estimate the height from memory. Option D. Have the patient remove shoes and stand straight with heels positioned properly. The correct answer is option D. Have the patient remove shoes and stand straight with heels positioned properly. Removing shoes and using proper posture on the stadiometer improves measurement accuracy. Sitting in a soft chair, excessive rounding, or relying on memory can produce an inaccurate record. Question 8. Before documenting in the chart, a provider asks for an apical radial pulse comparison during a realistic certification question. Which method is appropriate? Option A. Have two staff members count apical and radial pulses at the same time. Option B. Use pulse oximetry only and skip manual counting. Option C. Count radial pulse in the morning and apical pulse later. Option D. Subtract blood pressure from pulse rate. The correct answer is option A. Have two staff members count apical and radial pulses at the same time. An apical radial comparison requires simultaneous counts so a pulse deficit can be identified accurately. Separate timing, unrelated calculations, or relying only on a device does not measure the difference between heartbeats and peripheral pulses. Question 9. While following clinic policy, the medical assistant notes that a pulse oximetry reading remains very low after the sensor is repositioned for a new patient. Which action should the medical assistant take? Option A. Delete the result from the record. Option B. Tell the patient the reading is definitely normal. Option C. Report the persistent abnormal reading promptly according to office protocol. Option D. Wait until the next appointment to mention it. The correct answer is option C. Report the persistent abnormal reading promptly according to office protocol. A persistent abnormal oxygen saturation may signal impaired oxygenation and should be escalated promptly. Deleting results, falsely reassuring the patient, or delaying communication can place the patient at risk. Question 10. During a routine office visit, a patient waiting for the provider is involved when a provider asks for an apical radial pulse comparison. Which method is appropriate? Option A. Have two staff members count apical and radial pulses at the same time. Option B. Subtract blood pressure from pulse rate. Option C. Count radial pulse in the morning and apical pulse later. Option D. Use pulse oximetry only and skip manual counting. The correct answer is option A. Have two staff members count apical and radial pulses at the same time. An apical radial comparison requires simultaneous counts so a pulse deficit can be identified accurately. Separate timing, unrelated calculations, or relying only on a device does not measure the difference between heartbeats and peripheral pulses. Question 11. When preparing safe patient care, the medical assistant's hands are visibly soiled after cleaning a spill during a high-yield exam review. Which method is preferred? Option A. Wash with soap and water. Option B. Wipe hands on a paper towel. Option C. Put on a second pair of gloves over the soil. Option D. Use hand sanitizer only. The correct answer is option A. Wash with soap and water. Soap and water are preferred when hands are visibly soiled because mechanical washing removes material. Sanitizer alone, wiping without washing, or covering soil with gloves does not adequately clean the hands. Question 12. At a provider-requested assessment, a medical assistant experiences a needle stick while cleaning a room for a patient with a routine complaint. Which action should be taken first? Option A. Apply lotion and continue rooming patients. Option B. Hide the injury if bleeding stops. Option C. Wash the area and report the exposure according to policy. Option D. Finish all remaining tasks before reporting. The correct answer is option C. Wash the area and report the exposure according to policy. Immediate washing and prompt reporting start the post-exposure process and protect the employee. Hiding the injury, delaying reporting, or simply applying lotion can interfere with timely evaluation and follow-up. Question 13. After confirming the patient's identity, a patient is suspected of having active tuberculosis. Which precaution is most appropriate? Option A. Use only clean gloves. Option B. Use airborne precautions with appropriate respiratory protection. Option C. Place the patient in the waiting room until closing. Option D. Ask the patient to remove any mask to speak clearly. The correct answer is option B. Use airborne precautions with appropriate respiratory protection. Tuberculosis can spread through airborne particles, so respiratory protection and isolation procedures are needed. Gloves alone, extended waiting room exposure, or removing source control can increase transmission risk. Question 14. In a medical assistant certification review scenario, a reusable surgical instrument must be free of all microorganisms including spores while maintaining privacy. Which process is required? Option A, routine dusting. Option B, sanitization only. Option C, sterilization. Option D, plain water rinsing. The correct answer is option C, sterilization. Sterilization destroys all forms of microbial life including spores when performed correctly. Sanitizing, dusting, or rinsing lowers visible soil or some organisms but does not make an instrument sterile. Question 15. While following clinic policy, the medical assistant notes that a urine drug screen requires legal chain of custody handling for a patient with limited mobility. Which action is essential? Option A. Let the patient take the specimen home overnight. Option B. Use a routine sticky note instead of required forms. Option C. Leave the specimen unlabeled in the bathroom. Option D. Document specimen control and signatures at each transfer. The correct answer is option D. Document specimen control and signatures at each transfer. Chain of custody documents who handled the specimen and helps preserve legal validity. Unlabeled storage, patient transport outside protocol, or informal notes break the required control process. Question 16. A provider asks for assistance because a disinfectant splashes onto the counter and the medical assistant needs spill guidance. Which resource gives chemical handling information? Option A, insurance aging report. Option B, growth chart. Option C, appointment ledger. Option D, safety data sheet. The correct answer is option D, safety data sheet. A safety data sheet explains hazards, personal protective equipment, spill response, and first aid information for chemicals. Scheduling, billing, and growth records do not provide chemical safety instructions. Question 17. After confirming the patient's identity, a small contained fire is being addressed with a fire extinguisher after alarm procedures while preventing documentation errors. What does the first step in PASS mean? Option A, push the patient. Option B, pull the pin. Option C, pour water first. Option D, prepare billing forms. The correct answer is option B, pull the pin. PASS stands for pull, aim, squeeze, and sweep when using an extinguisher. The other choices are unrelated to extinguisher operation and may delay a safe response. Question 18. After confirming the patient's identity, a patient reports a severe latex allergy before rooming for an adult patient. Which action is appropriate? Option A, document the allergy only after the visit. Option B, ignore the report unless a rash is visible. Option C, use latex-free supplies and alert the care team. Option D, use powdered latex gloves for a better fit. The correct answer is option C, use latex-free supplies and alert the care team. Latex allergy can cause serious reactions, so latex-free supplies and team awareness are important before care begins. Ignoring the report, using latex products, or delaying documentation can expose the patient to harm. Question 19. A provider asks for assistance because a used venipuncture needle is ready for disposal. Which practice is safest? Option A, place it in a coat pocket until the room is cleaned. Option B, break the needle before disposal. Option C, avoid recapping and dispose of it immediately in a sharps container. Option D, recap with both hands to prevent leakage. The correct answer is option C, avoid recapping and dispose of it immediately in a sharps container. Avoiding recapping and placing sharps directly into the proper container reduces needle stick risk. Two-handed recapping, breaking needles, or carrying sharps in pockets are unsafe practices. Question 20. In a medical assistant certification review scenario, a medical assistant experiences a needle stick while cleaning a room while preventing documentation errors. Which action should be taken first? Option A, finish all remaining tasks before reporting. Option B, hide the injury if bleeding stops. Option C, apply lotion and continue rooming patients. Option D, wash the area and report the exposure according to policy. The correct answer is option D, wash the area and report the exposure according to policy. Immediate washing and prompt reporting start the post-exposure process and protect the employee. Hiding the injury, delaying reporting, or simply applying lotion can interfere with timely evaluation and follow-up. Question 21. After confirming the patient's identity, A coagulation study such as patient or INR is ordered for a returning patient. Which tube is typically used? Option A, lavender EDTA tube. Option B, yellow acid citrate dextrose tube. Option C, gray sodium fluoride tube. Option D, light blue sodium citrate tube. The correct answer is option D, light blue sodium citrate tube. Light blue tubes contain sodium citrate and are commonly used for coagulation testing. EDTA, fluoride, and acid citrate dextrose tubes have different additives and are used for other laboratory purposes. Question 22. During a skills check, the scenario states that a fasting glucose specimen is being collected. Which tube additive is commonly associated with glucose preservation? Option A, no additive in a culture bottle. Option B, sodium fluoride in a gray top tube. Option C, sodium citrate in a light blue tube. Option D, EDTA in a lavender tube. The correct answer is option B, sodium fluoride in a gray top tube. Gray top tubes commonly contain fluoride to help preserve glucose by inhibiting glycolysis. EDTA, citrate, and culture bottles serve different testing purposes and are not the usual glucose-preserving choice. Question 23. When preparing safe patient care, a tourniquet has been applied while locating a vein during the visit. Which practice helps prevent hemoconcentration? Option A, tighten it after blood begins flowing. Option B, apply it over broken skin for grip. Option C, leave it on until all paperwork is complete. Option D, release the tourniquet within about 1 minute when possible. The correct answer is option D, release the tourniquet within about 1 minute when possible. Prolonged tourniquet application can concentrate blood components and affect results. Leaving it on too long, tightening it unnecessarily, or placing it over broken skin can harm the patient or compromise the specimen. Question 24. A medical assistant reviews a case where a vein tends to roll during palpation for a patient in the exam room. Which action can improve venipuncture control? Option A, ask the patient to pump the fist throughout the draw. Option B, anchor the vein by pulling the skin taut below the site. Option C, tap the needle against the vein repeatedly. Option D, use the thumb above the puncture site. The correct answer is option B, anchor the vein by pulling the skin taut below the site. Anchoring below the puncture site helps stabilize the vein and improves control. Placing the thumb above the site, repeated tapping with the needle, or ongoing fist pumping can be unsafe or affect specimen quality. Question 25. For a pediatric patient in an outpatient setting, a patient has a small foreign material exposure in the eye. Which action is appropriate before irrigation? Option A, apply random medication drops without order. Option B, check the order or protocol and use appropriate solution and protection. Option C, ignore contact lenses and begin forcefully. Option D, use a dry cotton swab across the cornea. The correct answer is option B, check the order or protocol and use appropriate solution and protection. Eye irrigation should follow protocol with correct solution and care to prevent injury. Dry swabbing, unadhered medication, or forceful technique can damage the eye. Question 26. During a geriatric visit, a urine drug screen requires legal chain of custody handling after noticing a potential safety concern. Which action is essential? Option A, leave the specimen unlabeled in the bathroom. Option B, use a routine sticky note instead of required forms. Option C, document specimen control and signatures at each transfer. Option D, let the patient take the specimen home overnight. The correct answer is option C, document specimen control and signatures at each transfer. Chain of custody documents who handled the specimen and helps preserve legal validity. Unlabeled storage, patient transport outside protocol, or informal notes break the required control process. Question 27. After confirming the patient's identity, a clinic performs a rapid strep test classified as waived for a teen patient. What does waived testing generally mean? Option A, the test is simple and has a low risk of erroneous results when performed correctly. Option B, the result cannot be documented in the chart. Option C, only a physician may read the result in every setting. Option D, the test never needs quality control. The correct answer is option A. The test is simple and has a low risk of erroneous results when performed correctly. CLIA waived tests are considered simple with low risk when instructions are followed, but quality procedures still matter. Waived status does not remove documentation, training, or quality control responsibilities. Question 28. While following clinic policy, the medical assistant notes that a patient asks what hemoglobin A1C reflects. Which explanation is most accurate? Option A, kidney function during the last hour. Option B, white blood cell count after infection. Option C, average blood glucose control over roughly the past 2 to 3 months. Option D, blood oxygen level at this exact moment. The correct answer is option C, average blood glucose control over roughly the past 2 to 3 months. Hemoglobin A1C reflects long-term glucose exposure over the lifespan of red blood cells. It is not a real-time oxygen, kidney, or white blood cell measurement. Question 29. During an annual wellness visit, a throat culture is being collected for suspected strep throat while supporting safe patient care. Which technique is appropriate? Option A, swab the tonsillar area and posterior pharynx while avoiding the tongue and cheeks. Option B, touch the swab to the tongue repeatedly. Option C, dip the swab in tap water before collection. Option D, swab only the outer lips. The correct answer is option A, swab the tonsillar area and posterior pharynx while avoiding the tongue and cheeks. The tonsillar area and posterior pharynx are the target sites for a throat culture. Swabbing lips, contaminating with tongue contact, or adding tap water can reduce specimen quality. Question 30. When preparing safe patient care, a patient requests correction of information in the medical record for a new patient. Which action is appropriate? Option A, erase the original entry without documentation. Option B, change another patient's chart instead. Option C, follow the facility process for an amendment or addendum. Option D, tell the patient records can never be reviewed. The correct answer is option C, follow the facility process for an amendment or addendum. Medical records are corrected through formal amendment or addendum processes that preserve integrity. Erasing entries, refusing all review, or altering the wrong chart is improper. Question 31. A medical assistant reviews a case where a tube label and requisition do not match. Which action is most appropriate? Option A, stop processing and resolve the discrepancy according to policy. Option B, guess which name is correct. Option C, scratch out the name and keep going. Option D, send it to the lab without comment. The correct answer is option A, stop processing and resolve the discrepancy according to policy. Label and requisition mismatches create serious patient identification risk and must be resolved before processing. Guessing, altering labels casually, or sending the specimen without correction can produce dangerous errors. Question 32. For a new patient in an outpatient setting, a point-of-care glucose test is about to be performed while preparing for provider review. Which supply check is needed? Option A, cut the strip in half to save supplies. Option B, confirm the test strips are not expired and are stored correctly. Option C, use any strip from an unlabeled container. Option D, wet the strip before inserting it. The correct answer is option B, confirm the test strips are not expired and are stored correctly. Expired or improperly stored strips may produce inaccurate glucose results. Unlabeled strips, wetting strips, or altering strip size violates testing procedure and quality standards. Question 33. During a skills check, the scenario states that a patient is being prepared for a 12-lead EKG for an adult patient. Which action improves electrode contact? Option A, place electrodes over heavy clothing. Option B, apply lotion under each electrode. Option C, clean and dry the skin and remove excess hair if needed. Option D, skip preparation if the patient is in a hurry. The correct answer is option C, clean and dry the skin and remove excess hair if needed. Clean, dry skin improves adhesion and electrical signal quality for EKG electrodes. Lotion, clothing, and skipped preparation can increase artifact or lead detachment. Question 34. During a skills check, the scenario states that a chest lead is being placed during a 12-lead EKG. Where should V2 be positioned? Option A, right lower abdomen. Option B, 5th intercostal space at the left midclavicular line. Option C, the 4th intercostal space at the right sternal border. Option D, a 4th intercostal space at the left sternal border. The correct answer is option D, 4th intercostal space at the left sternal border. V2 belongs at the fourth intercostal space on the left sternal border. Right sternal placement is V1, fifth intercostal midclavicular placement is V4, and the right lower abdomen is a limb lead area. Question 35. A medical assistant reviews a case where a claim includes durable medical equipment supplied to a patient while preventing documentation errors. Which code set may be used? Option A, HCPCS Level 2. Option B, a pain rating scale. Option C, the provider's lunch schedule. Option D, only the patient's zip code. The correct answer is option A, HCPCS Level 2. HCPCS Level 2 codes are commonly used for supplies, equipment, and some services not fully described by CPT. Zip codes, schedules, and pain scales are not coding systems for durable medical equipment. Question 36. While following clinic policy, the medical assistant notes that a patient asks what a 12-lead EKG records for a patient with a routine complaint. Which response is accurate? Option A, it measures blood glucose through the skin. Option B, it injects dye into the coronary arteries. Option C, it records electrical activity of the heart from multiple views. Option D, it directly measures lung volume. The correct answer is option C, it records electrical activity of the heart from multiple views. A 12-lead EKG displays the heart's electrical activity from different lead perspectives. It is not a glucose test, pulmonary function test, or invasive dye study. Question 37. In a medical assistant certification review scenario, a patient reports new chest pain while an EKG is being recorded. Which action should the medical assistant take? Option A, finish filing old charts before reporting. Option B, tell the patient to drive home and rest. Option C, erase the tracing because pain changes results. Option D, notify the provider immediately according to emergency protocol. The correct answer is option D, notify the provider immediately according to emergency protocol. New chest pain can represent an urgent cardiac concern and should be escalated immediately. Delaying, advising the patient to drive, or deleting clinical information can endanger the patient. Question 38. When preparing safe patient care, a provider asks whether a tracing has a basic sinus pattern while supporting safe patient care. Which feature supports that pattern? Option A, a missing QRS after every beat. Option B, random spikes caused by loose leads. Option C, no relationship between atrial and ventricular activity. Option D, AP wave before each QRS complex with a consistent rhythm. The correct answer is option D, AP wave before each QRS complex with a consistent rhythm. Sinus rhythm generally includes AP wave before each QRS complex with consistent conduction. Missing QRS complexes, artifact spikes, or unrelated atrial and ventricular activity do not support a simple sinus pattern. Question 39. For a patient with hypertension in an outpatient setting, a patient is cold and shivering during an EKG for a patient with hypertension. Which artifact is most likely? Option A, muscle artifact that makes the tracing appear noisy. Option B, a guaranteed myocardial infarction. Option C, a normal calibration mark only. Option D, a blood pressure cuff leak. The correct answer is option A, muscle artifact that makes the tracing appear noisy. Shivering creates muscle activity that can make the tracing noisy and difficult to interpret. It should not be assumed to be a heart attack, a cuff problem, or only a calibration mark. Question 40. For a patient with limited mobility in an outpatient setting, a provider marks diagnoses and services after the visit for billing. Which document is often used? Option A, electrode tab. Option B, superbill or encounter form. Option C, autoclave pouch. Option D, suture package. The correct answer is option B, superbill or encounter form. A superbill or encounter form captures visit services and diagnoses for billing workflow. Sterilization pouches, suture packages, and electrode tabs are clinical supplies rather than billing documents. Question 41. A medical assistant reviews a case where a medication is about to be administered in the clinic before the patient leaves the clinic. Which check is part of safe medication administration? Option A, verify the right patient, medication, dose, route, time, and documentation. Option B, document before the patient receives the medication. Option C, Give the dose if the medication name sounds familiar. Option D. Skip allergy review if the patient is a regular visitor. The correct answer is option A. Verify the right patient, medication, dose, route, time, and documentation. The medication rights reduce errors by confirming key elements before and after administration. Familiar names, early documentation, and skipped allergy review can create preventable medication mistakes. Question 42. During a clinical skills check, an intramuscular injection is ordered in the deltoid site for a patient waiting for the provider. Which action supports safety? Option A. Identify the correct landmark and avoid injecting too low on the arm. Option B. Use the same site repeatedly without assessment. Option C. Choose the site through clothing. Option D. Inject directly into the elbow crease. The correct answer is option A. Identify the correct landmark and avoid injecting too low on the arm. Correct landmarking helps place the medication in muscle and reduces risk of nerve or tissue injury. The elbow crease, injection through clothing, or repeated use without assessment are unsafe techniques. Question 43. While preparing the exam room, a tuberculin skin test is being administered. Which technique is appropriate? Option A. Inject deeply into the gluteal muscle. Option B. Apply heat to spread the medication. Option C. Insert the needle shallowly with the bevel up to create a small wheal. Option D. Massage the site hard after injection. The correct answer is option C. Insert the needle shallowly with the bevel up to create a small wheal. An intradermal test is placed just under the epidermis and should create a small wheal. Deep injection, massage, or heat can alter the test placement and interfere with reading. Question 44. A provider asks for assistance because insulin is prescribed in units while preventing documentation errors. Which equipment is appropriate for measuring it? Option A. An insulin syringe calibrated in units. Option B. A household teaspoon. Option C. A tuberculin syringe marked only in milliliters without conversion. Option D. A medicine cup for tablets. The correct answer is option A. An insulin syringe calibrated in units. Insulin syringes are specifically calibrated in units to match insulin dosing. Household spoons, unconverted milliliter markings, and tablet cups do not provide safe insulin measurement. Question 45. During a skills check, the scenario states that a patient falls in the hallway and says their hip hurts for a patient with limited mobility. Which action is appropriate? Option A. Delete the event if no one saw it. Option B. Tell the patient to walk it off. Option C. Lift the patient quickly without assessment. Option D. Keep the patient still, call for help, and follow incident protocol. The correct answer is option D. Keep the patient still, call for help, and follow incident protocol. After a fall with pain, the patient should not be moved unnecessarily until assessed and help arrives. Rapid lifting, dismissing the injury, or hiding the event can worsen harm and violate reporting procedures. Question 46. During a routine office visit, a patient who appears anxious is involved when a patient taking furosemide asks why urination has increased. Which explanation is most accurate? Option A. Diuretics are used only for pain relief. Option B. Diuretics stop kidney filtration completely. Option C. Diuretics help the body remove excess fluid through urine. Option D. Diuretics are vaccines against infection. The correct answer is option C. Diuretics help the body remove excess fluid through urine. Furosemide is a diuretic that increases fluid and electrolyte excretion through the kidneys. It does not stop filtration, function as a vaccine, or serve only as an analgesic. Question 47. A medical assistant reviews a case where a patient develops hives, wheezing, and throat tightness after an injection after the patient asks a follow-up question. Which emergency medication may be indicated by protocol? Option A. Epinephrine. Option B. Oral iron only. Option C. Topical sunscreen. Option D. Routine multivitamin. The correct answer is option A. Epinephrine. Epinephrine is the first-line emergency medication commonly used for anaphylaxis because it supports airway and circulation. Iron, sunscreen, and multivitamins do not treat acute allergic airway compromise. Question 48. During a skills check, the scenario states that a handwritten order uses the abbreviation U for units for a pediatric patient. Which action is safest? Option A, clarify the order because you can be misread. Option B, assume you means unlimited refills. Option C, ignore the abbreviation and give any dose. Option D, change it to milligrams without asking. The correct answer is option A, clarify the order because you can be misread. The abbreviation you can be mistaken for a 0 or other marking, so clarification prevents dosing errors. Guessing, changing units, or giving an arbitrary dose is unsafe. Question 49. A medical assistant reviews a case where a patient asks whether to stop an antibiotic once symptoms improve. Which instruction is generally appropriate? Option A, double the next dose to finish faster. Option B, stop immediately when feeling better every time. Option C, follow the prescribed course and contact the provider before stopping early. Option D, save the rest for a family member. The correct answer is option C, follow the prescribed course and contact the provider before stopping early. Antibiotics should be taken as prescribed unless the provider changes the plan, which helps treatment success and stewardship. Stopping early, sharing medication, or doubling doses can be unsafe and ineffective. Question 50. A medical assistant reviews a case where ear irrigation is ordered for cerumen removal during a high-yield exam review. Which precaution is important? Option A, verify the order and screen for contraindications such as ear pain or perforation history. Option B, aim forcefully at the eardrum. Option C, use very hot water to dissolve wax quickly. Option D, proceed even if the patient reports severe ear pain. The correct answer is option A, verify the order and screen for contraindications such as ear pain or perforation history. Ear irrigation requires appropriate order, temperature, and screening because perforation or infection can make irrigation unsafe. Hot water, forceful aiming, or ignoring pain can injure the patient. Question 51. In a medical assistant certification review scenario, a vaccine is administered in the clinic for a new patient. Which detail should be documented? Option A, only the patient's favorite pharmacy. Option B, vaccine name, lot number, expiration date, site, route, and patient response is required. Option C, the weather outside the clinic. Option D, a guess at the manufacturer if the label is missing. The correct answer is option B, vaccine name, lot number, expiration date, site, route, and patient response is required. Vaccine documentation supports traceability, safety monitoring, and legal requirements. Pharmacy preference, weather, and guest manufacturer details do not replace required vaccine records. Question 52. A provider asks for assistance because a provider describes a patient's heart rate as bradycardic. What does this mean? Option A, high blood sugar. Option B, slower than normal heart rate. Option C, absent breathing. Option D, faster than normal heart rate. The correct answer is option B, slower than normal heart rate. Bradycardia means a slower than normal heart rate based on clinical context. Tachycardia, apnea, and hyperglycemia describe different findings. Question 53. A provider asks for assistance because a patient's blood glucose is described as hyperglycemic during a quality control check. What does the prefix hyper indicate? Option A, without pain. Option B, high or excessive. Option C, around the heart. Option D, below normal. The correct answer is option B, high or excessive. Hyper means high or excessive, so hyperglycemia refers to elevated blood glucose. Below normal, around the heart, and without pain are represented by different word parts. Question 54. A provider asks for assistance because a chart lists hypertension as a chronic condition for a patient who appears anxious. Which finding is associated with this diagnosis? Option A, persistently elevated blood pressure. Option B, low body temperature. Option C, low blood oxygen only. Option D, inflamed tonsils. The correct answer is option A, persistently elevated blood pressure. Hypertension refers to blood pressure that remains elevated over time. Oxygen saturation, tonsil inflammation, and temperature changes describe different clinical problems. Question 55. While following clinic policy, the medical assistant notes that two patients are placed in the same appointment slot. What is this called? Option A, double booking. Option B, capillary puncture. Option C, downcoding only. Option D, closed filing. The correct answer is option A, double booking. Double booking schedules more than one patient in the same time slot and should be used carefully according to policy. Capillary puncture, filing, and downcoding are unrelated terms. Question 56. A medical assistant reviews a case where a patient asks which organ produces insulin after the patient asks a follow-up question. Which organ should be identified? Option A, thyroid cartilage. Option B, spleen. Option C, gallbladder. Option D, pancreas. The correct answer is option D, pancreas. The pancreas contains cells that produce insulin for blood glucose regulation. The spleen, gallbladder, and thyroid cartilage do not produce insulin. Question 57. A medical assistant reviews a case where a medical term ends in itis for a pediatric patient. What does the suffix usually mean? Option A, inflammation. Option B, blood condition. Option C, visual examination. Option D, surgical removal. The correct answer is option A, inflammation. Itis means inflammation, as in dermatitis or tonsillitis. Surgical removal, visual examination, and blood condition are usually represented by ectomy, scopy, and EMEA. Question 58. A provider asks for assistance because a procedure name ends in ectomy. What does the suffix mean? Option A, inflammation. Option B, surgical removal. Option C, paralysis. Option D, enlargement. The correct answer is option B, surgical removal. Ectomy means surgical removal, such as appendectomy. Inflammation, paralysis, and enlargement use different suffixes. Question 59. In a medical assistant certification review scenario, the word gastroscopy contains gastro/o before documentation is completed. What body part is referenced? Option A, stomach. Option B, bladder. Option C, nerve. Option D, lung. The correct answer is option A, stomach. Gastro/o refers to the stomach and appears in terms involving gastric structures or procedures. Lung, nerve, and bladder use different combining forms. Question 60. In a busy family practice clinic, an older adult is involved when a vaccine is administered in the clinic for an older adult. Which detail should be documented? Option A, vaccine name, lot number, expiration date, site, route, and patient response is required. Option B, a guess at the manufacturer if the label is missing. Option C, the weather outside the clinic. Option D, only the patient's favorite pharmacy. The correct answer is option A, vaccine name, lot number, expiration date, site, route, and patient response is required. Vaccine documentation supports traceability, safety monitoring, and legal requirements. Pharmacy preference, weather, and guest manufacturer details do not replace required vaccine records. Question 61. During a walk-in visit, a patient is lying flat on the back for an exam. Which position is this? Option A, prone. Option B, lithotomy. Option C, Sims. Option D, supine. The correct answer is option D, supine. Supine means lying face up on the back. Prone is face down, lithotomy uses stirrups, and Sims is a side-lying position. Question 62. In a medical assistant certification review scenario, a patient reports burning during urination and urinary frequency while supporting safe patient care. Which condition may be suspected? Option A, urinary tract infection. Option B, myopia. Option C, otitis externa. Option D, sprained ankle only. The correct answer is option A, urinary tract infection. Burning with urination and frequency are common symptoms associated with urinary tract infection. Ear canal infection, nearsightedness, and ankle injury do not best explain urinary symptoms. Question 63. In a medical assistant certification review scenario, a patient has low hemoglobin and complains of fatigue for a returning patient. Which condition is being described? Option A, appendicitis. Option B, anemia. Option C, dermatophyte infection. Option D, hypertension. The correct answer is option B, anemia. Anemia involves reduced hemoglobin or red blood cell capacity and can cause fatigue or weakness. Appendicitis, hypertension, and fungal skin infection do not describe low hemoglobin. Question 64. During a skills check, the scenario states that a staff member asks for a patient's full chart to answer a simple billing question. Which HIPAA principle applies? Option A, send the chart to a friend for advice. Option B, use only the minimum necessary information to complete the task. Option C, share the entire chart because staff are curious. Option D, post the details in the waiting room. The correct answer is option B. Use only the minimum necessary information to complete the task. The minimum necessary standard limits access and disclosure to what is needed for the job task. Curiosity, public posting, or sharing outside the care team violates privacy expectations. Question 65. A provider asks for assistance because a term contains the combining form cardi/o while checking the chart. Which body structure is referenced? Option A, heart. Option B, skin. Option C, stomach. Option D, kidney. The correct answer is option A, heart. Cardi/o refers to the heart and appears in terms such as cardiology and cardiogram. Kidney, stomach, and skin use different word parts. Question 66. While following clinic policy, the medical assistant notes that a patient receives a statement from insurance showing allowed charges and payments for an older adult. What is this document called? Option A, prescription label. Option B, incident report. Option C, advance directive. Option D, explanation of benefits. The correct answer is option D, explanation of benefits. An explanation of benefits summarizes how an insurance claim was processed and what may be owed. Advance directives, incident reports, and prescription labels serve different purposes. Question 67. While following clinic policy, the medical assistant notes that an insurance plan states the patient must pay a set amount before coverage begins. Which term applies? Option A, consent form. Option B, copayment. Option C, contraindication. Option D, deductible. The correct answer is option D, deductible. A deductible is the amount the patient pays before the plan begins paying for covered services. A copayment, consent form, and contraindication are different healthcare terms. Question 68. For a patient with limited mobility in an outpatient setting, a claim needs a code for the patient's diagnosis before documentation is completed. Which code set is used? Option A, NDC only. Option B, CPT only. Option C, HCPCS Level 2 only. Option D, ICD-10-CM. The correct answer is option D, ICD-10-CM. ICD-10-CM codes describe diagnoses and reasons for encounters. CPT, HCPCS Level 2, and NDC identify procedures, supplies, or drug products rather than diagnoses. Question 69. While following clinic policy, the medical assistant notes that a claim includes durable medical equipment supplied to a patient for a patient who appears anxious. Which code set may be used? Option A, the provider's lunch schedule. Option B, a pain rating scale. Option C, only the patient's zip code. Option D, HCPCS Level 2. The correct answer is option D, HCPCS Level 2. HCPCS Level 2 codes are commonly used for supplies, equipment, and some services not fully described by CPT. Zip codes, schedules, and pain scales are not coding systems for durable medical equipment. Question 70. When preparing safe patient care, a patient has low hemoglobin and complains of fatigue. Which condition is being described? Option A, appendicitis. Option B, hypertension. Option C, dermatophyte infection. Option D, anemia. The correct answer is option D, anemia. Anemia involves reduced hemoglobin or red blood cell capacity and can cause fatigue or weakness. Appendicitis, hypertension, and fungal skin infection do not describe low hemoglobin. Question 71. A provider asks for assistance because an outside attorney requests a copy of a patient's medical record while preparing for provider review. Which action is generally required before release? Option A, give only verbal gossip about the visit. Option B, post the record in the portal without checking identity. Option C, obtain a valid authorization or follow a permitted legal process. Option D, send the record because the attorney sounds official. The correct answer is option C, obtain a valid authorization or follow a permitted legal process. Medical records generally require patient authorization or a valid legal basis before disclosure. Official-sounding requests, unchecked portal release, and informal gossip violate confidentiality. Question 72. After confirming the patient's identity, paper charts are filed alphabetically for an adult patient. Which name is usually used first? Option A, appointment room number. Option B, favorite color. Option C, street number only. Option D, patient's last name. The correct answer is option D, patient's last name. Alphabetic filing generally starts with the patient's last name to maintain consistent record organization. Color preferences, street numbers, and room numbers do not provide reliable alphabetic indexing. Question 73. In a medical assistant certification review scenario, several patients are scheduled at the beginning of the hour and seen in order of arrival or need. Which system is this? Option A, sterilization cycle. Option B, double entry bookkeeping. Option C, wave scheduling. Option D, pulse deficit scheduling. The correct answer is option C, wave scheduling. Wave scheduling brings multiple patients in during a time block to manage provider flow. Bookkeeping, sterilization, and pulse comparison are unrelated concepts. Question 74. During a skills check, the scenario states that a patient misses a scheduled appointment without canceling while following standard precautions. Which action is appropriate? Option A, bill any random amount without policy. Option B, delete the appointment from the record. Option C, discuss the patient publicly in the waiting room. Option D, document the no-show and follow office policy for follow-up. The correct answer is option D, document the no-show and follow office policy for follow-up. No-shows should be documented and handled consistently according to office policy. Deleting records, arbitrary billing, or public discussion creates administrative and privacy problems. Question 75. While assisting with patient care, a patient in the exam room is involved when a term contains the combining form CARDI/O for a patient in the exam room. Which body structure is referenced? Option A, heart. Option B, skin. Option C, stomach. Option D, kidney. The correct answer is option A, heart. CARDI/O refers to the heart and appears in terms such as cardiology and cardiogram. Kidney, stomach, and skin use different word parts. Question 76. A provider asks for assistance because a billing call is made about an overdue balance. Which practice protects privacy? Option A, discuss the balance with anyone who answers. Option B, leave detailed diagnosis information on a shared voicemail. Option C, verify the patient's identity before discussing account details. Option D, announce the debt in the waiting room. The correct answer is option C, verify the patient's identity before discussing account details. Identity verification helps protect financial and health information during billing conversations. Sharing details with unknown persons, detailed shared voicemail, or public announcements violates privacy. Question 77. After confirming the patient's identity, a patient has questions about risks before a minor procedure while prioritizing patient safety. Who should answer clinical risk questions for informed consent? Option A, a random patient in the lobby. Option B, the medical assistant by guessing. Option C, the provider performing or ordering the procedure. Option D, the receptionist only. The correct answer is option C, the provider performing or ordering the procedure. The provider is responsible for explaining risks, benefits, and alternatives so the patient can give informed consent. Reception staff, other patients, or guest explanations do not meet informed consent standards. Question 78. In a medical assistant certification review scenario, a procedure is performed after the patient clearly refuses touching for a patient with a routine complaint. Which legal concern may apply? Option A, defamation only. Option B, battery. Option C, capitation. Option D, abandonment only. The correct answer is option B, battery. Battery involves unauthorized physical contact and can occur when touching continues after refusal. Defamation, abandonment, and capitation refer to different legal or payment concepts. Question 79. While reviewing office protocol, a teen patient is involved when a clinic may be liable for an employee's actions within job duties. Which doctrine is described? Option A, respondeat superior. Option B, homeostasis. Option C, deductible carryover. Option D, informed refusal. The correct answer is option A, respondeat superior. Respondeat superior means an employer may be responsible for certain employee actions performed within the scope of employment. The other terms describe consent, insurance, or physiology rather than employer liability. Question 80. At a preventive care appointment, a patient with a routine complaint is involved when a patient reports a severe latex allergy before rooming while supporting safe patient care. Which action is appropriate? Option A. Use latex-free supplies and alert the care team. Option B. Ignore the report unless a rash is visible. Option C. Document the allergy only after the visit. Option D. Use powdered latex gloves for a better fit. The correct answer is option A. Use latex-free supplies and alert the care team. Latex allergy can cause serious reactions, so latex-free supplies and team awareness are important before care begins. Ignoring the report, using latex products, or delaying documentation can expose the patient to harm. Question 81. In a medical assistant certification review scenario, a patient uses a traditional health practice unfamiliar to the medical assistant for a patient with limited mobility. Which response is best? Option A. Ridicule the practice in the chart. Option B. Ask respectful, non-judgmental questions and share relevant information with the provider. Option C. Ignore it even if it may affect care. Option D. Tell the patient to stop without provider input. The correct answer is option B. Ask respectful, non-judgmental questions and share relevant information with the provider. Cultural competence involves respectful curiosity and accurate communication that supports safe care. Ridicule, unsupported instructions, or ignoring relevant practices can damage trust and miss safety issues. Question 82. During a skills check, the scenario states that a patient is anxious about a procedure. Which behavior shows active listening? Option A. Look away and type unrelated notes. Option B. Tell the patient anxiety is silly. Option C. Interrupt to finish the patient's sentences. Option D. Maintain appropriate eye contact and summarize the patient's concern. The correct answer is option D. Maintain appropriate eye contact and summarize the patient's concern. Active listening uses attention, reflection, and clarification to show the patient was heard. Interrupting, disengaging, or minimizing feelings can increase anxiety and reduce trust. Question 83. In a busy family practice clinic, a patient with limited mobility is involved when a patient says they are scared about a biopsy result after reviewing the order. Which response is therapeutic? Option A. That sounds frightening. I can let the provider know you have concerns. Option B. Everyone gets scared, so stop worrying. Option C. You should not ask questions. Option D. I know for sure nothing is wrong. The correct answer is option A. That sounds frightening. I can let the provider know you have concerns. An empathetic response acknowledges feelings and offers appropriate support without giving false reassurance. Dismissing fear, guaranteeing results, or discouraging questions is not therapeutic. Question 84. When preparing safe patient care, a medical assistant reports a patient concern to the provider using SPAR for an adult patient. What does the S represent? Option A. Superbill. Option B. Sterilization. Option C. Situation. Option D. Supine. The correct answer is option C. Situation. In SPAR, situation introduces the immediate issue being communicated. Sterilization, superbill, and supine are unrelated to the SPAR communication framework. Question 85. A provider asks for assistance because a term contains the combining form cardi/O. Which body structure is referenced? Option A. Stomach. Option B. Kidney. Option C. Heart. Option D. Skin. The correct answer is option C. Heart. Cardi/O refers to the heart and appears in terms such as cardiology and cardiogram. Kidney, stomach, and skin use different word parts. Question 86. During a geriatric visit, an office policy emphasizes avoiding preventable patient harm while maintaining privacy. Which ethical principle is involved? Option A. Respondeat copying. Option B. Non-maleficence. Option C. Downcoding. Option D. Capitation. The correct answer is option B. Non-maleficence. Non-maleficence means avoiding harm and is central to safe healthcare practice. Capitation and downcoding are payment or coding terms, while the third option is not a valid ethical principle. Question 87. After confirming the patient's identity, A clinic applies appointment policies fairly to all patients for a patient with hypertension. Which ethical principle is reflected? Option A, tachycardia. Option B, justice. Option C, hemolysis. Option D, polyuria. The correct answer is option B, justice. Justice involves fairness and equitable treatment. Tachycardia, hemolysis, and polyuria are clinical terms rather than ethical principles. Question 88. After confirming the patient's identity, a patient becomes angry about a long wait. Which response is best? Option A, use a calm voice, acknowledge the frustration, and offer to check the status. Option B, argue loudly in front of other patients. Option C, threaten to cancel care immediately without policy. Option D, mock the patient's concern. The correct answer is option A. Use a calm voice, acknowledge the frustration, and offer to check the status. De-escalation uses calm communication and problem-solving to reduce tension. Arguing, mocking, or threatening without policy can escalate the situation and harm the patient relationship. Question 89. When preparing safe patient care, a patient feels faint after a blood draw during the visit. Which action is appropriate? Option A, tell the patient to run outside for air. Option B, give insulin without checking blood glucose. Option C, leave the patient alone in the chair. Option D, help the patient lie down safely and notify the provider as needed. The correct answer is option D, help the patient lie down safely and notify the provider as needed. A faint patient should be protected from falling and assessed according to protocol. Running, leaving the patient alone, or giving unrelated medication can create harm. Question 90. For a returning patient in an outpatient setting, a rash is described as proximal to the wrist for a returning patient. What does proximal mean? Option A, closer to the trunk or point of attachment. Option B, farther from the trunk. Option C, toward the skin surface. Option D, on the back side only. The correct answer is option A, closer to the trunk or point of attachment. Proximal means closer to the trunk or the point where a limb attaches. Distal, posterior, and superficial refer to different anatomical directions. Question 91. For a patient waiting for the provider in an outpatient setting, a patient has a bleeding laceration while waiting for the provider. Which first aid step is appropriate? Option A, use bare hands to hold the wound. Option B, remove large embedded objects aggressively. Option C, apply direct pressure with appropriate protection. Option D, apply heat to increase bleeding. The correct answer is option C, apply direct pressure with appropriate protection. Direct pressure with PP helps control bleeding and protects the responder. Removing embedded objects, using bare hands, or applying heat can worsen bleeding or exposure risk. Question 92. For a patient with a routine complaint in an outpatient setting, a patient twists an ankle in the parking lot while preparing for provider review. Which first aid concept may be used initially? Option A, sterilize the ankle in an autoclave. Option B, heat, running, and deep massage immediately. Option C, rest, ice, compression, and elevation as appropriate. Option D, ignore swelling until next year. The correct answer is option C, rest, ice, compression, and elevation as appropriate. Initial sprain care often uses rest, ice, compression, and elevation to reduce swelling and protect the area. Heat, running, ignoring symptoms, or autoclaving are inappropriate. Question 93. A provider asks for assistance because a patient is pale, cool, clammy, and confused after an injury for a teen patient. Which condition is a concern? Option A, otitis externa. Option B, myopia. Option C, shock. Option D, acne. The correct answer is option C, shock. Pale, cool skin, clamminess, and confusion after injury can indicate shock and require urgent response. Nearsightedness, ear canal infection, and acne do not explain this emergency pattern. Question 94. When preparing safe patient care, an AED is available for an unresponsive patient with no normal breathing. Which action is appropriate? Option A, turn on the AED and follow its prompts while continuing emergency response. Option B, place the pads over thick clothing. Option C, use the AED only after the clinic closes. Option D, ignore the AED because it gives instructions. The correct answer is option A, turn on the AED and follow its prompts while continuing emergency response. AEDs are designed to guide rescuers through pad placement and rhythm analysis during cardiac arrest response. Pads over clothing, unnecessary delays, or ignoring available prompts can reduce effectiveness. Question 95. At the start of a same-day appointment, an adult patient is involved when a patient has a small foreign material exposure in the eye before the patient leaves the clinic. Which action is appropriate before irrigation? Option A. Apply random medication drops without order. Option B. Check the order or protocol and use appropriate solution and protection. Option C. Use a dry cotton swab across the cornea. Option D. Ignore contact lenses and begin forcefully. The correct answer is option B. Check the order or protocol and use appropriate solution and protection. Eye irrigation should follow protocol with correct solution and care to prevent injury. Dry swabbing, unadhered medication, or forceful technique can damage the eye. Question 96. When preparing safe patient care, a sterile tray is prepared for a minor procedure for a patient asking for clarification. Which action maintains sterility? Option A. Use items from a wet torn package. Option B. Turn away from the sterile field for several minutes. Option C. Keep sterile items above waist level and within view. Option D. Reach over the field with non-sterile sleeves. The correct answer is option C. Keep sterile items above waist level and within view. Sterile fields must remain visible and protected from contamination. Turning away, reaching over the field, or using compromised packages can contaminate supplies. Question 97. In a medical assistant certification review scenario, a dressing change is being performed on a draining wound. Which action is appropriate? Option A. Place soiled dressings on the clean supply tray. Option B. Use clean or sterile technique as ordered and dispose of soiled dressings properly. Option C. Reuse old tape to save supplies. Option D. Document the wound before assessing it. The correct answer is option B. Use clean or sterile technique as ordered and dispose of soiled dressings properly. Dressing changes require technique appropriate to the order and safe disposal of contaminated materials. Placing soiled items with clean supplies, reusing tape, or documenting before assessment can create infection and accuracy problems. Question 98. For a patient with limited mobility in an outpatient setting, a Snellen chart is used during screening before the patient leaves the clinic. Which function is being assessed? Option A. Distance visual acuity. Option B. Blood clotting time. Option C. Blood glucose average. Option D. Hearing threshold. The correct answer is option A. Distance visual acuity. A Snellen chart screens how clearly a patient sees at a distance. Hearing, coagulation, and glucose control require different tests. Question 99. For a patient with hypertension in an outpatient setting, a patient performs a pulmonary function test for a patient with hypertension. Which instruction helps obtain a useful result? Option A. Seal lips around the mouthpiece and follow coaching for a full effort. Option B. Breathe around the mouthpiece. Option C. Stop as soon as mild effort begins. Option D. Chew gum during the test. The correct answer is option A. Seal lips around the mouthpiece and follow coaching for a full effort. Spirometry requires a tight seal and strong coached effort for reliable measurements. Leaking air, early stopping, or chewing interferes with test accuracy. Question 100. During a follow-up visit, an order is for 500 milligrams and the available tablets are 250 milligrams each. How many tablets are needed? Option A. 0.5 tablet. Option B. 10 tablets. Option C. 4 tablets. Option D. 2 tablets. The correct answer is option D. 2 tablets. Dividing the ordered dose of 500 milligrams by 250 milligrams per tablet gives 2 tablets. The other amounts would provide too little or too much medication.